Hello and welcome. In this video portfolio, we would like to explore what integrative medicine can add to our current chronic pain treatment, where Western medicine fails to achieve satisfactory and long-lasting solutions in the patient's quality of life with an acceptable side effect profile. Our pilot slideshow is about CRPS, or complex regional pain syndrome, but this approach can equally be applied to other pain topics as well. We are not against Western medicine, but aim to complement it by improving its weak points whenever possible. Our aim is to understand the disadvantages and side effects of current medical treatments and how fascia work, such as laser acupuncture, massage techniques, herbs and psychological treatment may help address these limitations and better balance risk with benefit. This perspective complements Western medical drugs, aiming true recovery with a better quality of life rather than offering only temporary relief. Walking this integrative way, we can open new concepts and attempt to better understand vague clinical symptoms. The first step is the possibility that cells are organized as an electromagnetic system. The mitochondria are the batteries. The endoplasmic reticulum, which is essentially a bag full of calcium, is the capacitor that keeps voltage constant, and that cell membrane and its structured water layers are the wires as well as the consumer. The goal is to support quantum processes in the membrane-associated water layers that interact with consciousness. Meridians are light and electricity cables in the connective tissue layers, which organize cell growth and embryological development. Later in life, they are responsible for cooperation, coordination, and communication. They are the biological internet of the body, a cellular Wi-Fi system. This train of thoughts may enable us to see CRPS from an integrative point of view on the next slide. Once we understand that CRPS may originate from a blockage of the meridian, we must ask, what causes this blockage? From an integrative perspective, the blockage is not simply mechanical or neural, but an interference pattern emerging from the dysfunction of the corresponding internal organ. Obviously, there may be physical blockages as well, such as scarring due to previous trauma, or cold invasion and other external pathogens. Let's take CRPS in the arm. 3 meridians pass through this region: the lung, the heart, and the pericardium. Each of these meridians is paired with its respective internal organ. Interestingly, there is growing evidence linking ischemic heart disease to CRPS, which may reflect this organ-meridian connection. Similarly, dysfunctions in the lung or pericardium may also play a role. When an organ becomes energetically weak, it can no longer sustain its meridian signal. This leads to increased impedance within the meridian channel, especially if there is physical trauma. Trauma damages the fascia and disrupts the structured water layers within the extracellular matrix, making the meridian energetically invisible or blocked. From an integrative viewpoint, this leads to stagnation, electrical stagnation, inflammation, structured water decoherence and breakdown, edema, swelling and pain. Our therapeutic goal is to relax membrane tension, restore the coherence of structured water, support the associated organ system by improving mitochondrial function, reducing inflammation, and recharging membrane potential in an ordered, coherent, and optimally charged way. In short, we aim to restore energetic flow and re-establish the meridian organ dialogue, so healing can occur from both the inside and the outside. Let us see the current literature now. This study demonstrated that half of the patients became better on Western medical treatment, which means that in another half of patients it was not successful, or it was too difficult for the patients to tolerate it on the long term. This is why we chose CRPS, to demonstrate that we may improve the side effect profile and the patient's overall quality of life. Now, laser therapy. Based on this study, Meridian treatment with infrared laser may have a positive effect on this otherwise debilitating condition. Based on the previous slide, the background effect may be to increase energy level in the structured water grid to power mitochondria and to rebuild this water grid adjacent to collagen extracellular matrix and reduce edema. This study demonstrated that acupuncture helped with children with CRPS. Another study demonstrated that the beneficial effect of acupuncture on CRPS in soldiers. The relevant citation is available upon request, of course. Our conclusion may be that Western treatment is effective in just more than half of our patients. So the risk-benefit ratio may not be optimal, especially in the long-term outcomes. This is the point where integrative medicine may offer help with laser acupuncture and herbal medicine. Our aim is to reduce swelling by rebuilding the water layers and mobilizing bath water, support mitochondria, and reduce membrane tension with improving inflammation. Importantly, laser acupuncture treats the meridian itself, which may make distant changes in the paired organ, while herbs may exert their effect on both the meridian via and the organ water layers with biochemical support to the extracellular organelles. Herbs to support membranes inside the cells, the mitochondria and the endoplasmic reticulum at cell. This is our suggested protocol with an 830 nanometer wavelength laser to stimulate large intestine, small intestine, and perhaps heart and pericardium, all the arm meridians, including local fascia painful points. Herbal support include fascia relaxation, inducing autophagy and excretion of bath water while restructuring the structured water layers in the organ as well as the meridian. This is an integrative medicine protocol suggestion designed to demonstrate the effectiveness of laser acupuncture and herbs in the treatment of CRPS. Similar approaches can be designed for other diseases such as trigeminal neuralgia, trying to avoid the high-risk procedure of sphenopalatine ganglion block. We believe that this approach may create a more balanced approach where patients' quality of life can be improved, balanced with a significantly lower side effect profile. Thank you for watching.